Hi, my name is Jennifer Temby, and I'm going to be your nurse for today. Is it okay if I close the door? Okay, thank you. Just want to provide you with some privacy. Okay, and is it okay if I put my clipboard down? Perfect. Just going to sanitize my hands. Okay, and can I have your name and date of birth? Okay, and I'm just going to check it against your ID band. Perfect. Millie Larson, date of birth January 1st, 1936. Any allergies, Mrs. Larson? No known allergies? Perfect, that's what I have. So I'm here today because your doctor ordered a medication called haloperidol, and this medication just helps with agitation. I know you've said that you felt very on the edge and uncomfortable, in your exact words, that you were crawling out of your skin, so this medication should really help you with that feeling. We give it by intramuscular injection, so it's going to be an injection, and I'm going to do it in an area called your ventrogluteal area. So that is kind of on your buttocks on the side, so I'll help you get into a comfortable position to do that, but is that okay with you? It's okay? Perfect. Professor, normally I wouldn't put anything down of mine on the patient's bed, but just for the purpose of this video, I'm going to put my clipboard down that has my MAR here, just in the bed. Okay, and I want to go over the 6 patient rates for medication administration. So the right patient, the right medication, the right route, the right time, the right dose, and the right documentation. So the 6 rates. And I want to go over my supplies with you. So I have hand sanitizer, I have paper tape, a biohazard Trex container, medium-sized gloves, alcohol swabs, I have quite a few, gauze sponge, and Practa haloperidol. It is 1 ml vials, and it is 5 milligrams per ml. The expiration date is June 2029, so it's still within date. My first check would have been bringing the medication into the room, so I would have already done my first check. I would have pulled the medication, checked against doctor's orders, and that would have been check number 1. I just want to go over the dose that the doctor ordered. So the dose that the doctor ordered is 2 milligrams. So there's 5 milligrams for every 1 ml. So that means that 1 milligram would be 0.2 mLs, and the doctor ordered 2 milligrams. So that means 0.4 mLs is what we're going to draw up. And on my syringe, I have a 3 ml syringe, and there are 0.2 ml increments, so we will draw up 0.4 mLs. I also have a VD Safety Glide needle. It is a 23 gauge and 1 inch, which is what we need for an IM injection. We could also do the 1.5 inch, which is what I'm going to use for the ventrogluteal muscle. If I was doing the deltoid, I'd probably use a 1 inch. But being that this is ventrogluteal, I think the 1.5 inches more appropriate. So that's what we're going to use, and I have a trash receptacle right down here. Okay. Okay, Mrs. Larson, are you all ready? Okay, perfect. I'm gonna just move a couple of things, Professor. I'm using a lemon to be the injection site. So I'm going to don gloves. At this point, I want to do my second check with my medication before I draw it up. So it is Practa haloperidol, 2 milligrams intramuscular, and I have Practa haloperidol, 5 milligrams per 5 mLs, which we stated before would be 0.4 mLs to be drawn up to equal the 2 milligrams. Okay, and I'm going to get started. Prior to this part, I would patient the position on their left side, and I would have them bring their knees and hips up a little bit towards their chest, and then I'll explain the landmark of the ventrogluteal injection in just a minute. All right, so we're going to use an alcohol pet pad. Just want to show you, we're going to clean the top of that vial. And I actually want to, being that we did our second check, is write down the medication on my paper tape. So I'm going to do that first so I can have it ready. So it is Practa-Haloperidol. And we are doing 0.4 mLs to equal 2 milligrams. Okay, so that is all ready for when I drop my syringe. So I'm going to attach the needle to my syringe. I'm going to take the safety cap off. And I am going to draw back .2 mLs. And normally I wouldn't recap, but for the purpose of the video, I will, and I'm going to just do it one-handed and use my glove box to help me. Okay. And Professor, let's see, just want to show you. That is point, I don't know if you can see clearly, but 0.4 mLs. Okay. So I am going to now label this. Okay, the patient has already been positioned, as I said before. So what we want to do, Professor, is using our hand, I would make a space like this over their hip, and this area in the middle is where I want my injection to be. Now, this is going to be between the anterior posterior iliac crest and then the posterior iliac crest. So that would be this area here. It's kind of in the middle between those two regions. The palm of my hand should be over the trochanter. So that is how I find my landmark. And again, the injection would be right over here in this center part. So the patient is positioned on their hip. And I want to start by, before I start with them, I'm going to do my third check. So I'm going to bring my MAR back over, and I'm going to use the vial. I'm going to use a syringe. So it is Practa-Haloperidol 2 milligrams IM, and I have Practa-Haloperidol, and it is a 1 milliliter vial, which is 5 milligrams, which means every 0.2 mLs is 1 milligram. The doctor called for 2 milligrams. So I have drawn up 0.4 mLs in my syringe of Practa-Haloperidol. So that is my third and final check. And again, we already asked the patient if they have allergies, and they said no known allergies, and that is what I have documented. Okay, so I'm going to just open my alcohol swab, and we are going to swab from the inner to outer aspect. I'm going to just pretend I'm doing it bigger, being that we're by the hip, and I'm going to leave my alcohol swab there as my identification for my landmark. I would have already placed my hand as I showed you before, so I already would have my landmark picked out. For the injection of an IM injection, you always want to inject at 90-degree angle. And going to take my needle cap off. I'm going to hold the skin taut with my thumb and index finger. I'm going to inject at 90-degree angle, straight down. Holding the syringe with my non-dominant hand, I'm going to pull back on the plunger just 3 to 5 seconds. I'm aspirating for blood. And there is no blood return, so we're in the correct region. I'm going to place my hand back onto the patient's skin, and I'm going to slowly inject. Okay, I'm going to pull straight out. I want to engage my safety, dispose of this into a biohazard container, and I am going to use a little bit of gauze just to dab the site. Don't want to rub it, just a quick dab. Are you doing okay, Mrs. Larson? Very good. I am going to take all my garbage out of here and dispose of my gloves. I want to do hand hygiene. When I'm done with hand hygiene, I would help the patient reposition back to a more comfortable position. Okay. Now I want to document that I administered the medication, so I'm going to initial there. And I want to document that we did the right ventrogluteal, so I'm going to document the site. Okay, and I'm going to sign off. Okay, Mrs. Larson, so you did really good with that injection, and that's really going to help you feel better. I'm going to come back in a little while and just see how you feel after the medication. Is there anything I could do for you before I leave? Are you comfortable with how you're laying? You are? Okay. If you have any pain, discomfort, questions, or you need anything, please don't hesitate to reach us. You have your call bell right here. I'll see you later. Thank you.